Okay, Christina, what we're looking at here is my office setup, and we're going to talk today about utilizing the Boditrak within our medical clinical world. Okay, we all have a lot of fun with it on the driving range and with our lessons, but let's look at some medical application here. I use this on virtually every patient, and I have it set up in an open concept area. My treatment rooms are private, but it makes sense to have a large monitor like I have, like this, and my laptop and the Boditrak set up, because then I have access to it. I don't have to worry about being cut off from a room, and it makes it easy to flow. It's very user-friendly to do this. So come on in here, Christina, and focus on, we're going to look at one of the first things I do with just about every patient is I look at their standing posture. And when I stand on the Boditrak, you'll see how it gets centered out now, and I can get pretty close to 50-50 in my side to side. You see the 50-50 in my side to side if I load right, if I load left. So the first thing I'm looking for is how does that lateral COP set up? Okay, so we see there I'm pretty close, I'm right on 50-50 right now. So if we look at that individual who's presenting with a big side-to-side deficit, the most common one we'll see is in a right-handed person who tend to see 40-60, or at least a predominance on the right COP. And that has to do with different things like muscle mass on the right-hand side, and don't get COP confused with center of mass. That's a complex issue. Maybe talk a little bit about it. But today, my first number one thing to do with every patient is to have them centered on the Boditrak, have a look at their lateral shift and COP, and it tells me a lot about their general posture distortions. Everything from an IT band to a knee problem to an opposite shoulder and neck problem, all these things start to fit together, and it's very easy to explain to the patient when they see it graphically. From here we go right into teaching the biofeedback. The tip, if we come back in, and I'll talk about what we're going to do is we're going to teach a patient how to feel the centeredness and how to bring themselves into a tall spine position. And when they get in a tall spine position, we can get them right to 50-50 just like that. In most cases. If I can't, within 2 or 3 minutes, I know I've got a lot of work to do. So this is your first Boditrak tip for use in the clinic, and I hope it can be very useful as it has been for me. Thanks.